So, so what else does the report card reveal?
So I think COVID-19 has had a significant impact in a range of ways. And obviously, first of all, the impact directly on researchers, in that research labs have had to be closed pretty much across the board. And this is obviously devastating to the researchers, and creates great difficulty. Even collaborating internally is a problem, difficulties getting supplies and so on. And the researchers tell us that it's going to take at least 12 months and probably a bit longer just to get back to their sort of starting point where they were a year ago. So they're going to be quite a long way behind, and take some time to catch up. The other thing that the COVID-19 pandemic has done is obviously had an impact on funding for research, which is quite significant. There was so much uncertainty financially in the community and obviously for charities as well. We saw cancellations of donations, we saw reduced response rates and average gift reductions, so significant effects. And of course, the cancellation of charity events. As people will know, we haven't been out running around in the community the way we normally would. So very significant effects there financially. And the third area, I think, that's going to be really important, that's going to have a further effect as we look to the future, is actually the fact that people didn't present for their breast cancer screening last year. So in March, we had a typical number of screens of around about 70,000. And by April, that had dropped to 1,100.
Wow.
And overall, a drop of about 30% or over 30%. So that's a significant factor, because it doesn't mean that people haven't got breast cancer. You know, the numbers are going to be similar. And as we look to the future, these people are going to be presenting a little later in their disease. So that's significant, because early detection saves lives.
Yeah,
so that's a problem too.
So what would that do for their individual prognosis and their recovery times?
Well, it's very challenging. I mean, we're expecting this year 20,000 people will be diagnosed with breast cancer, and it may be even a little higher. But obviously, you know, presenting late is a really significant factor in reducing prognosis.
Yeah.
So it's going to have a detrimental impact, and we really need that to catch up. And it's going to put a strain on the system as we go forward. So that investment in research and getting research back on track is going to be critical.
So with that goal of 0 deaths by 2030, has that been put back by just a year, or do you think, given the flow-on effects, it might be longer than that?
It's really hard to say. I mean, at this stage, what we're hoping is that by increasing our investment and keeping our investment as high as possible, that we can catch up. So one of the things we did during the pandemic was to give our researchers additional salary funding. So we gave an extra 4 months of funding to over 50 researchers to make sure that they didn't cease their research and they were able to continue with the project. So we know that projects will continue to completion, which is really critical. And then the next step will be making sure that we increase our investment and really support more research going forwards.
Yeah. Okay, and more government help, I would assume?
Well, we're entirely funded by the community. So what we need is the help of the community. Government have their own research funding through the NH&MRC and other channels. Some of that was delayed as well, and there are some factors around that. So we know that looking to the future, there are challenges around the level of funding, and we also know that some researchers won't have the same level of pilot data to write their grants and support their funding applications, because they weren't able to collect that last year. So there's this ongoing knock-on effect.
Okay, Sarah Hosking, thanks for your time this morning. Appreciate that.
Thank you so much.